will be discussing Chapter 8, Risk Management, in the Nurse Practitioner's Business for Practice and Legal Guide, 6th edition, by Carolyn Bupert. Here is an overview of the items that I will be discussing. The first item is risk of making a clinical error. The second item is risk of being sued for malpractice. The third item is risk that public perception of the nurse practitioner is a poor quality provider. The fourth item is risk of exceeding legal scope of practice. The fifth item is risk of breaching patient confidentiality. The fifth item is risk of failing to fully inform patients of treatment and obtain consent. The seventh item is risk of failing to disclose information patients need to get follow-up. The eighth item is risk of poor quality ratings. The ninth item is risk of disciplinary action. The 10th item is risk of Medicare fraud for upcoding a patient visit. The 11th item is risk of business failure for undercoding patient visits. And the last item is risk of being accused of prescribing controlled drugs inappropriately. Risk of making a clinical error. Making a clinical error. Every patient should receive the standard of practice. Every nurse practitioner should look at themselves and make sure they're abiding by the standards of practice. Always practice consistently. With each diagnosis, you should do a set of criteria for each thing. Always use evidence-based practice. With evidence-based practice, you know you're doing what is best for that diagnosis. Turn to professional association guidelines if you're not certain of what the best practice guidelines are. That way you can determine what is the best for that diagnosis for that patient. According to the American Association of Nurse Practitioners, the nurse practitioner role requires a career-long commitment to meet the evolving needs of society and advances in healthcare. Nurse practitioners are responsible to the public and the adaptable changes in healthcare. As leaders in healthcare, nurse practitioners combine the roles of provider, mentor, educator, researcher, and administrator. All of these things should be remembered when taking care of patients. If a clinical error occurs, discuss it with the patient and determine the correct action needed. Risk of being sued when there is no clinical error. Anytime there is a poor outcome for a patient, you always have the risk of being sued for malpractice, even if you did everything and followed the best practice standards. Initially, you should talk with the patient to diffuse the situation. The patient is frustrated with the outcome and wants answers. So sit down with the patient and explain to them what happened, what could occur, what the plan is from here. Risk of public perception that the nurse practitioner is a poor quality provider. Appearance is what the patient sees first, so always make sure you look professional. Anytime you're with a patient, make sure you're attentive to their needs, what they're looking for, what the plan is for their diagnosis and their standards. Always follow up quickly with results so that the patient doesn't have to wait for a long period of time. Timeliness is very important with patient care. Communication is key in providing quality care. Ensure that the patient has a positive experience so that they will continue to spread a positive outcome for you. Risk of exceeding legal scope of practice. Know your state statutes. This is the current Kansas state statute for scope of practice for nurse practitioners. The key items say that the nurse practitioner can provide primary, secondary, and tertiary care as long as collaborating with one or more physicians. And the physician doesn't have to be present, but is directly accountable and responsible to the consumer. Authorization for collaborative practice means that the nurse practitioner is authorized to develop and manage the medical plan of care based upon the agreement with the physician. A physician is a licensed provider according to the State Board of Healing Arts. Risk of breaching patient confidentiality. To avoid confidentiality breaches, you should provide places to discuss patients so that no one can overhear you. Shred all records that you no longer need. Provide privacy screens for every laptop or computer that is being used for medical records. Lock all computers, and every employee should have a login so that you know who is using or writing what in the medical record. Always obtain a release of records so that the patient knows records are being released. If you breach confidentiality, according to HIPAA laws, you could be fined for breaches, and you could be reviewed for disciplinary action. Risk of failing to inform patients fully about their treatment. Treatment for every patient should include the patient. Always take the time to explain the diagnosis, how you came to the diagnosis, and what the follow-up care should be. Always give information to the patient on the diagnosis and follow-up care for them to take home. Always answer questions that the patient has so that they have a full understanding of the diagnosis. Informed consent. Anytime a procedure is being performed, the patient should receive information on risks, benefits, and other options of treatment besides the procedure. The provider should always answer any questions the patient may have so that they fully understand. Once the patient states full understanding, you will need to obtain a consent before initiating the procedure. If the patient refuses treatment, you should have them sign a refusal of treatment and explain the ramifications of the refusal of treatment for documentation and so that the patient knows if they don't obtain the procedure, there are risks. Risks of failing to disclose information that the patient needs to get follow-up. Any observation made during assessment should be explained to the patient, and a plan of care should be discussed. The patient is the manager of their care. We as providers need to empower them with the information to make an informed decision. Risk of poor quality ratings. Every provider is given a rating based upon their compiling data. Ratings are determined by Medicare and compiled data. 90% of healthcare plans use HADIS to determine performance of dimensions of care and services. HADIS is the Healthcare Effectiveness Data and Information Set. Here are two examples of HADIS. The first one is the weight assessment for counseling and nutrition and physical activity for children and adolescents. This gives you the criteria to determine that you have met the standard. So you should show that there is evidence that you calculated body mass index, including the height and weight. Counseling and referral of nutrition and indication nutrition was addressed. Counseling and referral for physical activity was addressed and was documented in the medical record. The second example is appropriate testing for pharyngitis. Children who are in an outpatient visit with only a diagnosis of pharyngitis should receive a Group A streptococcus test 3 days before or 3 days after the prescription. Unless the child has a history of an antibiotics prescription within the last 30 days of that encounter. Risk of disciplinary action. If you are performing your job duties according to the standards of practice, you are not at risk for disciplinary action. There are 4 items that can be given to the board as reported. Impairment is the inability to perform your job. Fraud is falsifying records or other items saying someone was there when they weren't. Gross negligence is not performing according to standards and not caring that you're not performing or having disregard for a person's life. Criminal activity, if for some reason a nurse has a criminal record, that has to be reported. So follow all standards of practice to avoid disciplinary action. Risk of being accused of Medicare fraud. You can be accused of Medicare fraud if you're upcoding charges. According to Bupert, upcoding is billing for a higher level of care than was provided. Learning the coding and what is needed for each charge to make sure you are in compliance. Consequences of Medicare fraud include loss of Medicare/Medicaid provider status, fines, loss of restriction on license, and loss of your job. So make sure you understand coding and what is needed for each charge. Risk of business failure. When you're undercoding billing, you're coding billing for a lower level of care than what was provided, creating a loss of revenue. Nurse practitioners need to code correctly so that you can be reimbursed correctly. Loss of revenue makes it difficult to cover expenses and could create business failure. Risk of being prescribed controlled drugs inappropriately. When prescribing controlled drugs, you need to use evidence-based practice. First, exhaust all treatments before going to higher risk treatments to make sure you've exhausted all options before prescribing controlled drugs. Document all items discussed and all treatments tried and failed. And anytime you are prescribing pain medications or any controlled substance, you should obtain a contract with the patient. That way, you and the patient have an understanding of what the requirements and expectations are. This will also allow you to have documentation of exactly what you expect from the patient. Here are my references. I hope you have enjoyed this presentation. Thank you very much for your time.